We are now back on the video record. The time is 3:03 p.m.
Thank you. Doctor, I want to get back to this article from March 6th of this year. At the end of this article, this brief paragraph, or 2 paragraphs, you make this statement, and I just want to ask if this is an accurate statement that you made. I think recognizing that if people have a cold, they really should be wearing start again. I think recognizing that if people have a cold, they really should be wearing a mask is something that will become part of our culture. Did you say that to this reporter?
Yes.
Okay. And you believe that, right?
Yes.
Okay. Now, as the director of health, at the time you made this statement, would it be fair to say that you wanted to use your position as the director of health to change the culture of Rhode Island citizens to accept masking as normal, like it is in Japan?
Objection, speculative form. Go ahead, doctor.
No, that's not a fair assessment.
So you were saying this as a private citizen, not as the director of health?
No, I didn't say that either.
Well, again, you were being interviewed presumably because you were the interim director of health. You weren't just Joe Smith off the street. I mean, there was a reason why they interviewed you, right?
Yes.
Okay. They wanted your take on what the new normal will be going forward, right?
Yes.
What normal would look like.
Yes.
That's what you're being asked to comment on. And what
Yes.
you want normal to be in the future is that people wear a mask if they have a cold in the future.
Objection form. Go ahead, doctor.
What I refer to is I think masks can become part of our culture and could be more likely in our culture. I think it's part of our culture now and it will stay that way for a long time.
So you're happy that it's become part of our culture?
Not a matter of being happy or sad. It's a matter of this is a public health intervention that people are going to avail themselves to. It's common in healthcare now. There's no requirement in healthcare, but it's common in healthcare. You see it in other settings too. Everywhere you go, you see people wearing masks. This is now part of our culture. I was out hiking this week and saw people wearing masks even outside. It's just part of our culture.
And you consider that a positive thing?
It's a public health intervention that's effective for people. So in healthcare, it's definitely got some benefit. When it comes to other settings, it's got benefit as well. Quite frankly, if someone's wearing a mask outside hiking in the woods, I don't know why they're doing that, but maybe it's because they have allergies and don't want to have a problem with the pollen. You know, I don't really know, but people are going to wear masks in our future. It's just part of our culture now.
Now, are you drawing a distinction between people who are doing it voluntarily versus being mandated to do it?
There's nothing in this interview that talks about a mandate.
Okay. So you were making these statements that this should become part of our culture, something that we do, but without being coerced into doing it.
Yes, this is something.
Form. Go ahead, doctor. Sorry.
Yes, this is something that has occurred, and it's something that will be part of our future. I'm not suggesting that there be a mandate.
Doctor, you're aware that there was a vaccine mandate, obviously, back for healthcare workers back last October, correct?
Yes.
Right. And while that vaccine mandate was in place, it was put in place under an emergency regulation, correct?
Yes.
So you had 180 days to come up with a new regulation before that emergency regulation expired, correct?
Objection relevance. Go ahead, doctor.
Yes.
Okay. And during that period of time, while that emergency regulation was in place, the Department of Health did a cost-benefit analysis regarding the vaccine mandate for healthcare workers, correct?
Objection, same. Greg, can I just have a running objection to this line of questioning?
Sure.
Thank you.
I don't know when the cost benefit analysis was done.
But you're aware that one was done, correct?
Yes.
And you're aware that as a result of that cost benefit analysis, the vaccine mandate for healthcare workers was eliminated, correct?
No, that's incorrect. There's still a requirement for people to either vaccinate or wear a mask in healthcare settings. There's a regular regulation that addresses that.
Right. Well, you can either be vaccinated or wear a mask, but you're not going to be fired if you're refusing to get vaccinated, correct?
I can't speak to human resource decisions from any employer.
Well, you, again, doctor, you want to be clear, right? You want people to hear you clearly. So let's be clear. Before the new regulation that came out regarding vaccines for healthcare workers, it was mandated you must be vaccinated to work in a healthcare field, correct?
No, it depended on what you did. If you did not have patient contact, you were not required to have a vaccine. So that's not true what you said.
But if you did have patient contact, you had to be vaccinated or you were prohibited from doing that, correct?
The language in the regulation specific, it was patient contact with a high it was some kind of likelihood of transmission.
All right. Okay, doctor, let me do it this way because I don't want to get too far afield. Why did the Rhode Island Department of Health not conduct a cost-benefit analysis regarding masking in schools?
Because there was no plan to make it a permanent regulation.
But you did testify that it's possible it could become a mandate in the future, right?
No, and I think I've covered this several times. You asked hypothetical situations. I answered your question about hypothetical situations. I've also said numerous times there is no plans in Rhode Island to mandate masks in Rhode Island for schools.
Well, doctor, are you aware that some school districts may on their own try to implement a mask mandate separate and apart from the Department of Health or the governor?
No, I'm not aware of that.
You're not aware that Providence instituted a mask mandate at the end of May of this year for schools?
I am aware of that. That's not what you asked me. You asked if I was aware of future mask mandates, and I said I'm not aware of that.
All right. Well, if a school district wanted to implement a mask mandate coming in September, would you advise against that?
Objection form is no longer with DOH. Speculation. Go ahead, doctor.
Right now, I see no reason for a mask mandate in schools.
So you would advise school districts who are thinking about implementing a mask mandate next September not to do?
Objection, same. Go ahead.
I'm not being asked by schools to advise them of anything. So I don't have a voice when it comes to what schools require. Schools require a lot of things.
But if you were asked, doctor, if you were asked, what would you advise them?
Objection, same. Speculation. Go ahead, doctor.
I think I've answered this numerous times. I don't see any reason right now in Rhode Island for a mask mandate this fall.
What about if I forget exactly the wording, the high tier, your low, medium, high tier, is that spread or is that, what's the phrasing of that?
I think you're referring to the Centers for Disease Control and Prevention Community Levels of Transmission, which came out in March of 2022. I'm just trying to reflect what I think you're trying to refer to. Is that what you're trying to refer to?
Well, again, I think the reason Providence reinstituted its mask mandate was because they were in a high tier community. That's the reason they gave, right?
So I don't know the reason Providence gave because I didn't talk to them about this and they didn't ask my opinion on this. What I know is that this community level of transmission, which is what the Center for Disease Prevention has, is what Rhode Island has adopted as our way forward. And yes, there is low, medium, and high rates of transmission. And we've already talked about what the criteria are for that. But I don't know if schools are going to use that to decide whether or not they're going to require masks or not.
again, would you advise them not to mandate masks, even if they're in a high tier community?
Objection form speculation no longer employed. Go ahead, doctor.
What I'm advising everybody to do is to follow the recommendations of the Centers for Disease Control and Prevention. And when you look at the Centers for Disease Control and Preventions, what it says is when you're in high transmission, indoor masking is recommended. That's recommended. You know, if schools want to do that, that's up to schools. They can decide what they want to do.
Well, doctor, you're aware that schools in this state do not have their own public health directors. They rely upon the Department of Health for advice on things like masking, correct?
I don't know that that's correct. Schools do have their own physicians, and they have their own nurses, and they have their own people. And if they ask the Department of Health for advice, we will give it.
And the advice would be, even if you're in a high tier community, you should be recommending masks, but you should not be mandating, correct?
Objection saying, go ahead, doctor.
Yeah, I don't support any mask mandate, you know, for schools this fall, based on what I know right now.
But if and you're trying to wiggle out of this, doctor, you said you want to try to be honest here. If a community is a high tier community next September, if Providence County is a high tier community September 1st of this year, will you recommend that school districts implement a mandatory mask policy, yes or no?
Objection form hypothetical cause for speculation. Go ahead, doctor.
Yeah, and just to be clear, I'm not working for the Department of Health after this month. So to be clear, I'm not recommending mask mandates. What we're recommending people do is follow the guidance from the Centers for Disease Control and Prevention. Now, to put a fine point on it, because I'm not wiggling out of anything, what the Centers for Disease Control and Prevention says is if we get into high transmission, and it's high transmission, not high tier, but high transmission, that means our cases are high. Hospitals have a lot of patients, and there's more people being admitted, then universal indoor masking is recommended. Since school occurs indoors, then universal masking is indoors is recommended. But if you're asking me if we should ask the schools to mandate it, and the answer is no, I'm not interested in mandating anybody to do anything. And quite frankly, I didn't even know the schools in Providence and Central Falls did this. I don't know the other schools did this in the state didn't do it. So that was up to them. Schools made their own decisions.
It's going to be very interesting when I take the depositions of people at the Department of Education, when they tell me that they look to the Department of Health for guidance on this, and what they were told in May was you should implement a mask mandate. That's going to be very interesting when they testify to that, don't you think?
Objection form. Go ahead, doctor.
Mr. Petrelli, I didn't tell anyone in the Department of Education to have a mask mandate. And, you know, what you find interesting is up to you.
But apparently Jamie Camella did without your authority. That's what your testimony is.
Objection form speculation.
Yeah, as I've said earlier, I don't know what conversations Jamie Camella had with the Department of Education.
I'm going to put up Exhibit 10. This is just... Where's Exhibit 10?
Sorry, Greg, you say 10?
Yep.
Got it, thank you.
So, doctor, this is an executive order that was issued by the governor on June 7th, extending the declaration of emergency due to COVID that was originally instituted on March 9th of 2020, correct?
I see what you have in front of me. Yes, that's what it says.
All right. Now, this was done on June 7th. You were still the interim director, correct?
Yes.
Did you advise anyone in the governor's office on whether or not to extend that emergency declaration?
No.
Do you know, was anybody in the Department of Health advising the governor's office on whether or not to extend this emergency regulation?
I don't know.
Do you know why he extended it?
No, I don't. I wasn't consulted on this.
Do you agree that he should have extended it?
Objection, form speculation. Go ahead, doctor.
I can't speak for the governor on this.
Do you have any idea why he would have done this?
Objection, form. Go ahead, doctor.
I would be speculating.
Well, speculate. You get to do that in depositions, doctor.
There might be some federal funding requirement to have some state of emergency. I just simply don't know. I wasn't consulted.
Do you think we're still in a state of emergency for COVID?
Objection, form. Go ahead, doctor.
If there's an executive order that says we are, then that's up to the governor to decide.
No, I'm asking you, in your position as the interim director of the Department of Health on June 7th of this year, did you think we were still in a state of emergency?
You know, as far as effect on our healthcare system and the cases, no, I don't. But I don't know the rationale for this. I don't know why it was ordered. There's other reasons why people do things. I wasn't consulted on it.
Are you aware that other states have dropped their declaration of emergencies months, if not years ago? For example, Massachusetts dropped it over a year ago, correct?
I don't know when Massachusetts dropped their state of emergency.
You don't care what other states are doing about declarations of emergency?
Objection, form argumentative. Go ahead, doctor.
So the statement you made was, you asked me if I was aware that Massachusetts dropped their state of emergency a year ago. What I responded was, I don't know when Massachusetts dropped their state of emergency. Then you said, I don't care when other states drop their state of emergency.
I guess I misunderstood or misheard your answer. So you are aware that Massachusetts dropped their state of emergency. You just don't know when that happened.
I am aware that they dropped their state of emergency. I agree with you. I don't know when it happened. And I don't know about other states when they've dropped theirs. But certainly, you know, other states have done other things. I understand that.
Doctor, do you know the new director of the Department of Health? Is it Uptala Bandy?
Yes, I do know Dr. Uptala Bandy.
Okay. Have you known her long?
I've known Dr. Bandy for over 10 years.
Did she work in the Department of Health before she was made director?
Yes.
Where does she work in the department?
She works in the Division of Epidemiology.
Okay. Are you aware of a interview that she gave on July 5th of this year at the Thunder Mist Health Center in West Warwick?
No.
Okay, let me pull up Exhibit 12, which I'll send out, Chris Ann. This is, again, another WPRI article. I believe this was, no, I'll get the author of it.
No problem.
And it indicates that on July 5th, Governor McKee and Dr. Bandy were at the Thunder Mist Health Center and talking about the importance of getting children under 5 immunized. And Dr. Bandy made a statement which I found kind of remarkable. I want you to comment on it. She's quoted as saying, preschool-age children are vectors of many respiratory viral infections. So if you can corral them and get them vaccinated and lower the burden of any kind of respiratory virus in that population, you are going to save the grandparents, the parents, and extended family from catching the disease as well. Did you know she had, before I just read that to you, had you heard that statement before?
No.
Okay. I think it's quite a remarkable statement. Do you agree with the statement?
Yes, I agree with the statement.
Okay. So you agree in calling preschool age children vectors? Seems pretty dehumanizing, doesn't it?
Objection, form. Go ahead, doctor.
Preschool age children do spread disease, and a term that is used sometimes is vectors. In other words, it is common knowledge that preschool children do spread disease from themselves to their grandparents. What Dr. Bandy said was accurate. There's other viral infections. Another respiratory infection is respiratory syncytial virus. which can have, serious morbidity and mortality effects on
But
on
doctor, I want
grandparents.
to focus on the word vector. You think that's an appropriate word to use to describe human beings, particularly young children?
Objection, form, and argumentative. Go ahead, doctor.
It's simply a public health term, and I haven't used this term to describe children, but what it means is children do spread disease to other people, and that's a true statement.
So you're saying that the term vector is a public health term to refer to human beings?
Objection, form. Go ahead, doctor.
A vector is any individual or any organism or any living creature that spreads disease. Mosquitoes are vectors. There's other animals.
So children are like
vectors.
mosquitoes?
Objection, form, argumentative.
I mean, are they like rats? I mean, what do you understand? I mean, doctor, do you know who Dr. Andy Boston is?
Mr. Picciarelli, I'm just trying to process that you just referred to children as rats. And I'm quite frankly offended by that, to be quite honest
Well,
with
I
you.
am too. Doctor, I'm not referring to them as rats.
You simply
what I'm
just
suggesting is the word vector. You talk to them about, you call them mosquitoes.
No, doctor.
Objection, argumentative. That's not what was said.
No.
You said that they're like mosquitoes. You said mosquitoes are vectors. Children are vectors. You equated children with mosquitoes.
No, Mr. Picciarelli, again, this gets to the issue that I find troubling with you, which is that.
All right, I'm not going to let you. I'm limited on time, so I'm not going to let you.
You're interrupting me, and I'm not lecturing you.
You're going to answer my questions, doctor, and stick to answering my questions.
I'd love to answer your questions. If
Do
you
you
stop
know who
interrupting me,
Dr.
I would.
Andy Boston is?
Thank you.
Well, yes, he was at the preliminary injunction hearing.
Do you know Dr. Andy Boston is Jewish, of Jewish extraction? Did you know that?
No, I do not know. I do not know that at all.
Do you understand how someone of Jewish, of the Jewish faith might be offended by referring to young children as vectors of a disease?
Objection, form, argumentative, speculative, compound. Go ahead, doctor.
No, I don't understand why anybody would be offended by this.
Do you know the Nazis? Do you know the Nazis referred to Jews as vectors of disease back in the 30s?
Objection, form, doctor.
No.
You didn't know that? All right.
No.
How about corralling them? That seems, again, dehumanizing. You corral animals. You don't corral humans, right?
Same objection. Go ahead, doctor.
Yes, that is true. You do not corral human beings.
So Dr. Bandy using the term corral, that was not an appropriate term for a health official to use, particularly the head of the health department in Rhode Island.
It's not a term I've used in the past, nor is it a term I would use. It's a matter of opinion whether it's appropriate or not. The larger point she's trying to get across in this quote is that children spread disease to other people. Some of them are their grandparents. That's her point.
Yeah. Do you have any evidence that children spread the disease in any significant way to their grandparents? Is there any medical literature on that?
It's common knowledge that children spread disease. I can testify as an expert in pediatrics that children spread disease to their parents, to their grandparents. In other words, because children—
I'm saying at any greater level than other people spread it?
If you would please let me finish. Most viral infections are spread via the respiratory droplets or spread by contact. Since children are often in proximity to their parents or grandparents, children do spread disease. This is commonly reported with influenza. It was the main rationale for why children were recommended to be vaccinated against influenza. So children do spread disease. That's my expert opinion on that.
Do children spread the disease any more so than other people in the population?
Yes, my expert opinion is children spread the disease more so because children need to be cared for. In other words, infants in particular are not able to care for themselves. Therefore, their parents need to be in proximity to them or their grandparents or other caretakers to do routine activities of daily living, like feeding the child, hygiene for the child, and other matters of safety for the child. So because other adults are in close proximity to children, they are more likely to spread the disease than other people. So yes, children, infants in particular, do spread disease at a higher rate than adults.
Doctor, you know that this deposition is being video recorded, correct?
I do.
Okay. Are you concerned that this will become public, this deposition?
I don't know how to answer that. I mean, a lot of things I do have become public.
Doctor, there's nothing you said here today in this deposition that you would be concerned would become public, correct?
No, there's nothing I've said today that I'm concerned would become public.
Okay. Do you know that the state has filed a motion just today to try to prevent my clients from making this deposition public?
Objection, form, misrepresentation. Go ahead, Dr. Bob. Oh my gosh, I'm sorry. Dr. McDonald, I apologize.
Yes, I was aware an objection is being filed. My understanding is a concern about how things can be taken out of context to mislead the public. That's my concern for why there was a motion for a protective order.
Are you concerned that your statements here today could be taken out of context in some way?
Objection, form, cause for speculation. Go ahead, doctor.
Yes.
How would they be taken out of context?
I don't know how they'd be taken out of context, but things are taken out of context.
Okay. Are you concerned about any personal embarrassment because of this deposition?
No.
Okay. In this memo, it's referenced that Dr. Boston, who you say you know, obviously, has made a number of postings about this litigation, correct?
Objection, Greg. This memo was not shared with the doctor before today.
Oh, I'm sorry. Well, are you aware that Dr. Boston has made postings about the case on his personal blog?
I actually don't follow Dr. Boston at all.
I'm just asking if you knew that or not.
I don't know what he's posting.
All right,
I quite frankly don't follow him.
All right, so somebody else must have told the Attorney General about this. Somebody else is following Dr. Boston, not you.
Objection, argumentative.
That's good to know. Well, apparently someone told the Attorney General that Dr. Boston posted your home address and cell phone number. Are you aware that Dr. Boston has done that?
No, I'm not aware he's done that.
So you don't know whether or not Dr. Boston released your home address, where until a few weeks ago you resided with your family, and released your personal cell phone number. I'm sorry. The cell phone number was another public employee. So you're not aware as to whether or not Dr. Boston released your home address, your prior home address.
Greg, I'm just going to object just based upon form and that this was a legal filing, but go ahead.
Yeah, I'm not aware of it. Like I said before, I really don't follow Dr. Boston at all. I don't know what he does.
Yeah. By the way, your home address that you lived in Rhode Island, that wasn't secret, was it? Anybody theoretically could find out what that is, just like any of us. I mean, people's homes addresses are often public records, right?
Objection, form. Go ahead, doctor.
Yes, my home address is a public record. However, I have to admit, I'm quite curious now why someone like Dr. Boston would feel the need to release my home address since he's considered.
Well, he denies that. But by the way, Dr. McDonald, he denies that he did that.
Well, I certainly hope so.
But I'm just reading what the state attorneys, your attorneys, by the way, these are your attorneys, Dr. McDonald. You understand that, right?
Yes, I do.
Go ahead.
When these attorneys file things, making assertions, they're making them oftentimes on your behalf, right, Dr. McDonald?
Objection, form, legal conclusion. Go ahead, doctor.
Yes.
Yeah. So maybe in the future, it'd be a good idea for you to review anything that the state attorney general files on your behalf before they do it to make sure it's accurate. Just a bit of advice there.
Objection, form, argumentative.
So does the Department of Health monitor the social media accounts of people?
Not that I'm aware of.
The Department of Health does have a social media account, right?
The Department of Health has a Facebook account and a Twitter account, as far as I'm aware of. If they have others, I'm
Right.
just not aware of them.
Right, and that Twitter account, do you know who runs it?
Are you talking about the Rhode Island Department of Health Twitter account?
Correct.
No, I don't know who runs it.
All right. Is it at RI Health? Is that the Twitter account?
I don't know what our Twitter account is.
Does anybody who runs this Twitter account have to report to you, or when you were the director, about what they post on that Twitter account?
There are people who are in a communications department who reply to messages, and they do not need my approval to reply.
Okay, so who in that communications department has the authority to make these replies publicly?
I don't know. I don't know all the communication staff.
So it could be some 20-year-old intern who's just writing things on this Twitter account, and you'd have no idea what they're writing.
Objection form. Go ahead, doctor.
I'm not aware of any 20-year-old interns who work for the Rhode Island Department of Health, and it would be highly unlikely that anybody who would reply for anyone on behalf of the Department of Health didn't have to run it by their supervisor. My assumption is that it's the communications lead who approves the content that goes out.
Is that Joseph Wendelkin?
No, that'd be Andrea Bagnall de Goss.
I'm sorry, Andrea.
Bagnall de Goss.
Can you spell that, please?
Andrea
Yeah.
Bagnall -DEGOS.
And she is the head of the social media communications?
She's the head of our communications area.
Does Mr. Wendelkin work in that same area? Or
Yes.
is that a different area? Okay, so she's his superior?
Yes.
Okay. So she would be the person to ask who runs your Twitter account?
Yes.
Okay. So do you know whether or not, now I'm going to show you, do you see this document? It's going to be exhibits 14A, B, and C. Can you see this? There's a picture, there's a name, Madalena, 6/15/22. Very nice
Yes.
picture of one of my clients, Madalena Serengati. I think, hopefully I pronounced it right. I should, I'm Italian too. You're aware that she's one of the plaintiffs in this case, correct?
I'm not familiar with all the plaintiffs.
Right. Do you recall her testifying at one of the preliminary injunction hearings?
I do not recall her testimony.
Okay. All right. Well, on 6/15 of this year, she apparently was tweeting a reply to your department's official Twitter account. You were still the director at the time. And she's talking about the issue of the vaccine for young children. It says something about, a product that doesn't prevent illness, doesn't stop transmission, doesn't have any long-term safety data. By the way, you agree with all that, right?
No, I don't agree with those statements.
Excuse me, Greg, can you reduce the size so that we can see the tweet? Because my screen's only showing a couple lines. The plus and minus arrow next to the 115.
Is that better?
Yep, now we can see the whole thing. Thank you.
Okay. So it then goes on to talk about over 1 million reports of injury to VAERS. You know what VAERS is, right?
Yes, I do.
Yeah. And what is VAERS?
It's the Vaccine Adverse Event Reporting System.
Okay. And what does that mean? What do they do? What is
Anybody can report any potential side effect to a vaccine. Anybody can make a report.
Okay. It's been around for a long time, right?
Yes.
Okay. And are you aware that prior to COVID, the reports of injuries from vaccines were pretty consistent, but that since the COVID vaccine, those reports have gone up exponentially. Are you aware of that?
Yeah, these are reports to VAERS. It doesn't mean there's any credibility to them. It just simply, anybody can report to VAERS. Just so the number itself could refer to a lot of different things.
Okay. So apparently someone at Rhode Island Department of Health Twitter account was monitoring Madalena because 2 days later, they send this text. Or tweet, I'm sorry.
One
Hi.
more time. There you go. Thank you.
Hi, exclamation point. You see why I'm thinking it's a 20-year-old intern that's writing this? I mean, who writes hi, exclamation point? Nobody of your generation, nobody of our generation, doctor, would write that. Well, you would agree.
I don't agree. I mean, quite frankly, I'm sure you have a point here. I'd love it if you'd get to it, though.
So someone from your Department of Health Twitter account felt the need to respond to Madalena and challenge her on this VAERS, just the way you just did, right?
Yes, the response from the Rhode Island Department of Health is accurate.
You think that's appropriate, that they're responding to somebody like Madalena, who's a plaintiff in this case?
I don't know that the person who
Objection
responded.
form. Go ahead, doctor. Thank you.
I don't know the beginning part of this. Is there something above this? What was
this? Is a response. That
understood. What's
the
above?
response to this? Madalena wrote this. Madalena was writing a tweet back at Rhode Island Department of Health.
What is she replying to? What is Madalena replying to?
I think it was a tweet promoting the vaccine for under 5-year-olds.
You think? I mean, couldn't you have clarity on that? You're the one who brought this exhibit in. I'd like a little certainty in here. What is she replying to?
See, the point of this, doctor, isn't what she wrote. The point is that someone from the Department of Health is monitoring her Twitter account.
Well,
you think that's appropriate?
Yes.
Objection form calls for speculation.
So you do. So you admit that the Department of Health has been monitoring the Twitter accounts of my clients in this case?
Objection, mischaracterization, forms, speculation. Go ahead, doctor.
Yeah, no. I mean, you're many things, Mr. Petrelli, but you are consistent. I asked for what was the original posting. You've admitted you don't know what it is. Miss Madalena replied to the Rhode Island Department of Health. Someone from the Department of Health replied to her. This is simply a courtesy. It's a very courteous response. It's accurate. It looks like a response we probably replied many times before. And as far as who wrote it, I don't know, but it's probably something they've replied hundreds of times before to anybody, because it looks like, kind of a canned language is my guess here. But I don't think it's anything untoward about this one bit. I think they're just trying to, engage in a conversation, which is what social media is about. But again, if you had the original posting, which you don't, I could give you more context.
Okay. So you think it's appropriate for the Department of Health to be responding or monitoring the plaintiffs in this case?
Objection for mischaracterization of evidence. Compound. Go ahead, doctor.
Yeah. So, Mr. Petrelli, one, you don't have the original post. Two, there's nowhere that identifies in this post that this woman is a plaintiff in this case. What you see is a response. In other words, yes, the Rhode Island Department of Health has a Twitter account. Yes, there's people who respond to people. That's called courtesy. Part of using social media is to provide conversation. Yes, Madalena asked a question of the Department of Health. She asked a question. My team responded to her. Yes, it's appropriate, but you're mischaracterizing that somehow a plaintiff was targeted. That's not the case at all. This is what social media is.
Doctor, you seem so confident that this just happens to be a response to one of the plaintiffs in this case. That you're trying to deny without denying that the Department of Health is monitoring the social media accounts of my clients. But in this memo that was just filed today by your lawyers, they admit that they've been following Dr. Boston's social media account. So you are monitoring your department or the attorneys in the Attorney General's office on behalf of your department have been monitoring the social media accounts of my clients and my expert in this case. And I'm asking you if you think that's appropriate.
Objection, form, mischaracterization of evidence, speculation, compound. Go ahead, doctor.
Yeah, Mr. Petrelli, I don't agree with your conclusion. I mean, quite frankly, it looks like here's what happened. The Department of Health put a posting on Twitter, probably some kind of health promotion thing. Madalena, of her own free will and her own choice, chose on her own to engage in conversation. There was no one soliciting her, as far as I know, to respond to that. She chose to do that. Quite frankly, if your client doesn't want the Department of Health to respond to her, then I would just say, why is she even posting on our Twitter feed? But she chose to, because she chose to. And I doubt anyone at the Department of Health, myself included, knows who the plaintiffs are in this case, because quite frankly, the Department of Health has a lot going on. And I don't know that anyone's really paying attention to this case out of those who are directly involved in it. What I'm telling you is the people for the Department of Health simply responded to a Twitter feed. This is just called being courteous. And yes, I think it's very appropriate that people at the Department of Health be courteous and respond to people. And they're just trying to do their jobs.
So the fact that somebody in the Attorney General's office wrote a memo where they cite 3 instances of postings by Dr. Boston, your testimony is that you know of no one at the Department of Health that's been involved in this.
Objection form compound. Go ahead, doctor.
You know, Mr. Petrelli, I've answered this as many times as I can think of. I don't know anyone who's following Dr. Boston. I certainly am following him. I don't pay attention to him at all. I mean, quite frankly, I don't know why you keep this coming up here, but quite frankly, I'm not sure what to tell you. I don't pay attention to Dr. Boston.
Okay. I'm going to take a brief break now, Chrisanne. I might be done.
Thank you, Greg. I'm just going to turn off audio and video until you tell me to turn it back on, okay?
I will. Yep.
Thank you.
Are we going off the record? Okay, we're going off the video record at 3:44 p.m. The time is now 3:51 p.m. and we are back on the video record.
Thank you.
Doctor, just one last area of questions. And this gets back to children being a driver of the pandemic. And I just want to be clear, maybe the use of the language previously was a little poor on my part, so let me be clear. Do you have any evidence that in the last 2 years of this pandemic, that children are key drivers of the pandemic?
Yes.
Okay. Are you aware of the Pediatric Infectious Disease Journal?
Yes.
Okay. Are you aware that in April of 2022, they published a study, the role of children and young people in the transmission of SARS-CoV-2?
I'm not aware of the study.
Okay. Are you aware that in that study, they concluded, quote, there is no convincing evidence to date, 2 years into the pandemic, that children are key drivers of the pandemic? That would seem to directly contradict what you just said, doctor.
Well, I don't agree with that assessment.
You don't? Okay. But you do know this journal, and it's a reputable journal, right?
It's a peer-reviewed journal, and I know it, yes.
Yeah. Maybe you should go back and take a look at it before you start accusing children of being vectors that need to be corralled. I have no further questions. Thank you,
Mr.
Doctor.
Piccarelli, I
No,
object.
gentlemen, stop. Objection form argumentative. I need to get my objection on the record. Objection form argumentative. Greg, thank you for your time today. Are we done with the questioning?
We are done. Let's go
Thank
off
you
the
both
record,
very
but
much.
can you just stay on for a minute off the record?
Sure. Let's get the
Doctor can go, everybody else can go.
stenographer. Great.
And before we go completely off the record, doctor is free to leave, but I do need to get the video orders if you'd like them synced or unsynced.
I'm sorry, what? I don't want to you ask. What?
If you wanted a video order and if you wanted it synced or not.
What does sync mean?
It means that they sync it to the transcript. So I believe it means they like add like a caption and they make sure the video is synced with like the caption of the transcript, you know, with the audio.
I don't need it synced.
Okay, I don't have an answer yet. Can I get your email and email you?
It's above Chris Ann's pay grade.
Totally above my pay grade.
Yeah, I can get you the email. And I'm sorry, Greg, did you want a copy of the video in general or just not synced?
Yeah, I think I already talked to Mary Beth about that. Yeah.
Yeah, give me 1 second. I'll get you the email. I can tell it to you out loud, I guess, since you probably need that. So the email would be video.production at esquiresolutions.com.
Did you get that?
I'm gonna rely on, Mary Beth or somebody sending me that email. I'm not gonna write
And
that
if-
down.
And so if there's, do you need any other orders on the record?
No, nothing on the record. No, I think we're done on the record.
Can you repeat that email one more time? Video production.
Video.production. So video period production
Yep.
at esquiresolutions.com.
Got it. That's
And
why I
it's-
messed up.
And it's solutions, plural.
Yes. Production is singular, solutions is plural.
Excellent.
Okay.
Thank you.
Thank you.
And so before, real quick, so this concludes today's deposition of James McDonald, MD. We're going off the record on Thursday, July 7th, 2022 at 3:55 p.m.